Welcome, and thank you for joining us this afternoon for today's Lunch and Learn Complications of Diabetes. My name is Kathy Chern, and I am a Consumer Health Librarian at East Brunswick Public Library. Today's program is brought to you by Hackensack Meridian Health and the library's Just for the Health of It initiative to promote community health and wellness. Our speaker today is Dr. Reema Patel, FACE Medical Director, Diabetes and Endocrinology Center, Hackensack Meridian Health, Raritan Bay Medical Center, Old Bridge. Please be aware that this talk is being recorded. Please keep your microphones muted and your webcams off. When available, the recording will be available for viewing at ebpl.org/YouTube. If you have any questions, please type them into the chat box. Our speaker will answer questions throughout the presentation as well as during the Q&A at the end of the talk. Please be aware that our speaker cannot provide medical advice to attendees during this program. And without further ado, I'll turn things over to Dr. Patel.
Hello, everybody. As I was introduced, my name is Dr. Reema Patel. I'm the Medical Director of the Endocrinology and Diabetes Center at Old Bridge, Raritan Bay Medical Center. And today we're going to be talking about complications of diabetes. Oh, hold on one second while we fix the technical. All right, so before we talk about complications of diabetes, let's all learn as to what diabetes is. So diabetes, as we commonly know it as high blood sugar, or some people say, well, I have a sugar problem. It is the inability of the body to either produce insulin when you don't have enough insulin, or the problem is that you have insulin, but you just cannot use the insulin efficiently. Now, what is insulin? Insulin is a hormone that is produced by the pancreas, and it helps in the absorption of glucose from the blood. Now, as I said, the problem with diabetes is either the patients don't have enough insulin or they have it and they just cannot use it, which we call as insulin resistance. Now, to talk about what kinds of diabetes are there, well, there is type 1 diabetes, where you have absence or deficiency of insulin. Type 1 diabetes is usually diagnosed earlier on, so patients are usually younger at the time of presentation, and it is usually quick in onset. So suddenly they go from being normal to having very high blood sugars. Again, this is a generalized scenario, but again, of course, there are exceptions that can happen. And type 2 diabetes, which is the majority type of diabetes that we see, is when there is either defective secretion of diabetes, or as I talked about a little earlier, there is insulin resistance. There is also gestational diabetes, which is when diabetes is diagnosed during pregnancy. And as I said, type 2 diabetes is the most common, which accounts for more than 90% of the cases of diabetes. There are some other kinds of diabetes as well. And for the sake of the presentation, I will not be going over the details of that, but these are the most common kinds of diabetes that we see. Now, what are the symptoms of diabetes? Well, the problem is a lot of times there are no symptoms. Sometimes when the blood sugars are very high, then the symptoms can include increased thirst. Patients complain of being thirsty all the time. They urinate a lot. They may have wounds that may take a long time to heal. Some patients can complain about blurry vision. Some may have tingling or numbness, and some may even have weight loss. So again, the symptoms may or may not be there, which is why it is important to keep up with your physicals. I will talk about who should be screened and when you should be screened. But again, sometimes you have no symptoms. So just because you have no symptoms does not mean that you cannot have diabetes. Now, again, who should be screened for diabetes? As I said, type 1 diabetes usually begins earlier on in life. And if you have a family history, say, for example, somebody in your family has type 1 diabetes, you should educate the other family members about the signs and symptoms of diabetes. But routine screening, should I get screened just because one of my family members has diabetes type 1? No. Routine screening is not indicated if there is an asymptomatic family member. Of course, if symptoms happen, definitely you should be screened. In terms of type 2 diabetes, you should be screened if you are overweight or obese. And this is defined by what we call as a BMI, or a body mass index. So we have a height, we have a weight measurement, and based on this, there is a calculation that is called as a BMI, and that is how the number is either for being overweight or obese. If you have family history of type 2 diabetes, yes, you should be screened. If you have PCOS, which is polycystic ovarian syndrome, you should be screened. If a female has a history of delivering a baby that is more than 9 pounds, that is also something that you should be screened for diabetes. If you have high blood pressure, high cholesterol, you should be screened as well. And there are certain ethnic populations that are at a higher risk of developing diabetes. For example, Asians, African Americans, Hispanics, Native Americans. These are some ethnic groups that are at a higher risk of developing diabetes. And again, if you are more than 45, you should be screened as well with no risk factors. So again, these are when we recommend screening for diabetes. Again, when we talk about how do we know if we have diabetes, well, it is through blood tests. And of course, the symptoms, again, if you have the symptoms, then you should contact your doctor about getting tested. If you have a hemoglobin A1c, anybody who is in the audience who has diabetes is very well aware of what an A1c or a hemoglobin A1c is, because that is one very important test that we measure not only to diagnose diabetes, but also to follow through as to see as to how your diabetes is doing, whether you're well controlled or not. So a hemoglobin A1c is an average blood sugar over the past 3 months. Any number that is more than or equal to 6.5% is a diagnosis for diabetes. The other ways to diagnose diabetes is a fasting blood sugar more than 126, or if you have a random blood sugar, any day, anytime, if you have a sugar of more than 200, or if you have a glucose tolerance test, that number comes up to be more than 200. These are the various ways how you diagnose diabetes. And there is actually a good test, and again, I can actually post it in the chat a little bit later, but these are actually tests which are developed by the American Diabetes Association. And if you actually go online to their website, they have and if you type what I just did, this is actually a risk test. It asks you for certain of your information and tells you if you are at risk or not. So if you are wondering if I am at risk for diabetes, this is actually a good place to go to. I have also put in the information about the American Diabetes Association website. It's a great tool. It's a good reference. They have a lot of recipes. They have a lot of meal planning. They have a lot of information about diabetes, about the screening. Very good information that I encourage actually all my patients to utilize as well. Now, the question that everybody asks, how can I prevent diabetes? So again, there are certain factors that you can help or modify, and there are certain that you cannot, right? Again, genetics is one factor that is not modifiable, but the modifiable factors, which play actually a very big role in both prevention and treatment for diabetes, are lifestyle, and that includes diet and exercise. Now, if you are overweight or obese, if you lose about 5 to 10% of your weight, it definitely improves your metabolic status and it can help you prevent diabetes. And again, this is, in terms of activity, what we say is 150 minutes a week, which is approximately 30 minutes, a day if you do like a physical activity, again, 20 to 30 minutes, depending on how many days a week you do it. But again, a cumulative of 150 minutes a week. But again, the important thing is moderate physical activity. I tell my patients, a lot of patients ask me, is walking enough? Well, any kind of activity that breaks you into a little sweat is called as a moderate physical activity. Of course, if you have heart conditions, if you have lung conditions, you have to speak to your doctor to make sure that you are safe to do the activity that you're planning to do. But in general, if you do 150 minutes per week of moderate physical activity, that is what will help you in preventing diabetes. And again, it also works in getting your diabetes better. Same concept holds true for that as well. Now, coming back to what we were just talking about, how do you treat diabetes? Well, lifestyle is number one, right? Again, treating diabetes is never medications, medications, medications. Lifestyle plays a big role in treating diabetes. I tell my patients, look, you are the driver of the car. I am actually in the back seat managing you, but unless the patients take control of their diabetes, otherwise, if you don't follow the diet and exercise, then every time you come to your doctor, it's going to be more medications and more medications. So there are a lot of things that we as, whoever is treating your diabetes thinks about when we are deciding what medication or what injection is right for you. We look at other medical conditions that you have, for example, obesity. We look at if you have heart disease, because there are certain drugs in the diabetes world that are specifically indicated not only to reduce your diabetes, but also to reduce your cardiovascular mortality, meaning they're good for the heart. And same thing with kidney disease. So if you have kidney disease, there are certain medications that we cannot give, and there are certain medications that we should give. So again, there are a lot of things that are taken into consideration before we decide which medication is the right one for the patient. We also think about the effect on weight, because there are certain medications that can make you gain weight, certain medications that are neutral, and certain medications that actually help you lose weight along with getting your diabetes better. So again, a lot of factors, and hypoglycemia, which is low blood sugar. So again, certain medications can cause it, certain medications not. Again, we have to keep all of that into consideration when we decide the medication. Again, if you have type 1 diabetes, if you remember, as I said, there is deficiency of insulin. So you have to treat it with insulin. That is type 1 diabetes. If you have type 2 diabetes, of course, on top of lifestyle modification, there are oral medications, there are many pills that you can take, there is insulin, and there are a lot of non-insulin injectables as well. So my patients tell me all the time, again, they see advertisements on the TV. Oh, doc, that injection that I saw an advertisement about, can you prescribe me that insulin? Well, there are lots of medications, a lot of insulin, there are a lot of injections that are actually not insulin injections. They are non-insulin injections that are used for the treatment of diabetes. Let me just see. Oh, thank you for posting the link. So the link for the diabetes risk test and the ADA, the American Diabetes Association, has been posted. So if anybody's interested, and if you're on your phone and if you want to save it, please do so. Otherwise, don't worry. Just remember American Diabetes Association, and you do a search on that. It will definitely take you that. So no worries. And I think I will just have to bear with me 1 second. Okay, all right. Now, this is probably one of the very important slides of the presentation, I would say, and it's a very good food for thought. I'm going to talk about food, and it is actually good food for thought, which we teach our patients as a diabetes plate method. Now, in this diabetes plate method, we talk about half of the plate. As you can see on this picture, half of the plate is actually filled with non-starchy vegetables. And you can see the vegetables that are out there that are non-starchy, right? Again, we're not talking about any starchy vegetables. 1/4 of your plate should be filled with starch or bread. So you see the small amount of starch or carbohydrates that we recommend for patients with diabetes. It's pretty much 1/4 of your plate. And then again, 1/4 of your plate is filled with protein. Again, try to choose lean protein if you can. So again, this is called as the plate method. And again, of course, you should incorporate, again, some dairy and some, if you can tolerate it. Water is the best drink if you're choosing drinks. Definitely, again, stay hydrated with water. Try to limit the amount of soda that you are consuming. Try to incorporate some fruits in the diet as well. So again, it's a very important concept. Again, fill half of your plate with non-starchy vegetables and 1/4 with protein and 1/4 with starch. So this is called as the plate method, a diabetes plate method. Now, the question is, why are there so many patients with diabetes in this age? Again, there is a huge rise in the number of patients with diabetes. 1.5 million people actually will be diagnosed with diabetes this year, which is a huge amount. And diabetes is the leading cause of kidney failure, of non-traumatic leg amputations. It's also the leading cause of new cases of blindness, heart disease, and stroke. So again, if you look at the big impact, not only just diabetes, but all of these are actually complications of diabetes, uncontrolled diabetes. So it has a big healthcare impact. Now, why are we seeing a rise in the number of cases? Well, it's because the life expectancy is increasing. And also, as we said, there are certain ethnic groups that are more susceptible to developing diabetes. There is an increase in that ethnic groups. That also accounts to the increase in the number of patients that have diabetes. And again, parallels with the obesity epidemic we have, definitely we see that. And the lifestyle changes, right? Again, COVID itself, talking about COVID, has also limited the access to gyms, that the patients used to have. So again, things were closed down for some time. So again, physical inactivity and unhealthy food choices, that also has to go hand in hand as to why there is an increase in the number of patients with diabetes. Now, we talked about the symptoms and signs, right? Again, sometimes we have no symptoms. We also talked about symptoms of high sugar. As we said, patients are thirsty a lot, you urinate a lot, you have blurry vision. Sometimes if the sugars are too high, patients can have vomiting, nausea, abdominal pain as well. So these are some symptoms. If you have diabetes, if you're having these symptoms, check your blood sugar, because these are all symptoms of high blood sugar. On the other end, there are also symptoms of low blood sugar that you should not ignore. And again, if the sugar is low, patients usually feel shaky. They will feel that their heart is beating very fast. Dizziness can happen. You can sweat a lot. So these are symptoms that you should not ignore, because that means now you're having a low sugar that you need to fix. And of course, the complications of diabetes are, some of the complications are heart attack and stroke. So if you're having symptoms of a heart attack, chest pain, or if you're having symptoms of stroke, weakness, or facial droop, please do not ignore these symptoms, because patients with diabetes are at an increased risk of developing these. So do not ignore the symptoms of high sugar, low sugar, or complications of diabetes. Again, diabetes affects a lot of organs. So again, if you look at, again, this is a little busy diagram, but I'm going to try to make it a little simple. It affects the eyes, right? We recommend routine eye care for patients with diabetes. So again, high blood sugar can damage the eyes, can damage the blood vessels in the eyes, and you can have what we call as diabetic retinopathy. So you should go to your eye doctor regularly to get screened for retinopathy. It affects the kidneys. It affects the nerves, what we call as neuropathy. So again, high blood sugars, especially people who have not very well controlled diabetes, they can have neuropathy. Now, in neuropathy, you can have tingling, numbness. People complain and feel differently. Some people say, I'm walking on a cotton, or some people say, I have tingling, or I just cannot rest, and I feel as if I have numbness. So again, both tingling and numbness can happen. Now, if numbness happens and if you hurt your foot, you don't feel it. You get injured, you get ulcer, you don't feel it. So it's important. We'll talk about foot care a little bit later, but neuropathy is a complication of diabetes. So again, you should go to your foot doctor, podiatrist regularly to get screened for that as well. As we talked about, it increases the risk of heart attack and strokes. And again, peripheral vascular disease, which means narrow vessels, which leads to poor blood supply to the organs. So gangrene can happen, which may lead to amputation. So again, these are all complications that can happen if your diabetes is not under control. So talk a little bit about diabetes and kidney disease. To put it simply, we eat something. So again, the digested products are normally cleared to the kidney and be excreted in the urine. And particles like protein and red blood cells, they are too big. And so they don't normally pass through the kidneys. Now, when you have uncontrolled diabetes, or one of the complications of diabetes is that because the kidneys are damaged, they become leaky. And so these particles are, they are lost, and so the useful proteins are actually leaked in the urine. What can you do for that? Get your diabetes better. There are certain medications that you can most patients with diabetes are on to protect the kidneys. And it is also important to maintain good blood pressure. Again, all of this together can protect the kidneys. And again, what happens if you don't treat it? Well, if you don't treat it, then the kidneys will become worse, the damage will worsen, and it can lead to end-stage kidney disease and dialysis. To talk a little bit about diabetes and eye disease, diabetes is the leading cause of vision loss in patients in the age of 18 to 64. And again, sometimes there are no signs and symptoms. You don't feel it. And the important thing that I want you to remember is that if you do a routine eye exam, it can prevent 95% of the vision loss that can be caused by diabetes. So it is very important to get screened. Go to your eye doctor. Usually they do a dilated eye exam to ensure that you don't have diabetic retinopathy. And again, keep your diabetes under control. And again, if your ophthalmologist finds a problem, then you should routinely go back for follow-up and get treated and tested. So again, those are the things that you can do for your eye health when you have diabetes. Now, we went over this a little bit, but I'm going to go over this again because I think this is very important. So again, as we said, the diabetes patients can have foot problems. So as we talked about neuropathy, people can have tingling and pain and weakness, but sometimes they can also have loss of sensation. And as I said, this leads to infection. Now, skin changes can also happen in patients with diabetes, and the skin can be dry, it can peel, it can crack. So this is also one of the skin changes that we see for diabetes. If you have a poor blood supply, then that will lead to, if you have a wound and if you don't have enough blood supply, then that wound will not be able to heal. And if there is narrow or hard blood vessels, that can again further compromise the healing. Some patients with diabetes can have deformities or shape changes in their feet. What can you do for that? Well, diabetes control, blood pressure control, cholesterol control. And again, smoking is a very big risk factor for poor blood supply. So if you are smoking and if your doctor tells you you have poor circulation, the one thing that you can really do to get it better is actually stop smoking. To talk a little bit more about diabetes and foot problems, calluses. Now, calluses actually build faster in patients who have diabetes. So because you have high pressure areas, right? We walk on the foot, so there is high pressure area under the foot. Don't try to treat yourself. I mean, again, if you try chemical agents, you can actually burn your skin. And if you burn your skin and if you have diabetes that is not under good control, that can actually lead to deeper infections, and that can actually put you in more trouble than what you already are. So please consult your doctor before trying things on your own. Seek help from professionals. There are foot doctors that are called as podiatrists who can definitely help you with that. So what happens if you have callus? Well, I have a callus. Okay, it doesn't bother me. Well, if you have a callus, it can break. And if it breaks, it can get infected. And if it, again, you can have an ulcer. And again, that can lead to deeper and deeper infections. And that's when the problem happens. So even a callus can, if not treated or, taken care of, can cause big problems. Now, diabetic shoes, actually a lot of insurances cover diabetic shoes and inserts. So speak, it is again dependent on your insurance, but again, you should speak to your doctor about seeing if your insurance covers diabetic shoes. And again, it could be prescribed by the podiatrist, which is the foot doctor. You can try using pumice stone on wet skin, and then you have to moisturize after. But again, be careful. Again, if you're not comfortable doing it yourself, please don't do it, because again, you may end up in a worse condition than what you are, because you can get infection, and that can actually be a bigger problem. Now, one other important foot problem with patients with diabetes is what we call as intermittent claudication. What that is basically a lack of blood supply. And again, you can have, patients complain, oh, when I have pain in my calves, when I try to walk a long distance, or if I'm trying to walk fast, or if I'm trying to walk uphill, I actually have pain. And then as soon as I sit down and rest, well, the symptoms go away. So again, this is actually, a symptom that you may not have enough blood supply, and you should get tested by your doctor, and you need to check for blood supply. As I said, again, what can you do for that? There are, of course, get your diabetes better, get your blood pressure better, get your cholesterol better. Besides that, again, there are certain medications that can be given to help with that. If needed, surgery is an option to make sure that you have enough blood supply. Exercise actually is a good treatment, again, as tolerated, that builds more blood supply is also recommended. And again, as I told a couple of slides ago as well, smoking cessation. Smoking is a very big risk factor for this. So definitely smoking cessation has a big role to play. Now, foot ulcers. So again, as you can see in the picture, the most common location of a foot ulcer is either on the ball of the foot or on the bottom of the big toe. Now, if you have an ulcer on the side of the foot, that's probably because the shoes are not fitted well. You're wearing some ill-fitting shoes, but most of the ulcers are usually either on the ball of the foot or at the bottom of the big toe. And it may or may not hurt. As I said, neuropathy, again, if you have neuropathy and you have no sensation, you have no feeling down in the bottom of your feet, you may not feel it. That's a problem, right? Again, so do not neglect it, because if you neglect it, this can actually lead to deeper infections. And, so there are some patients who, unfortunately, because of that, need amputations, meaning that, some part of their toe or foot needs to be cut out because the infection has spread too far. What do we do with foot ulcers? Again, we take x-rays, we take MRIs to see how deep the infection has spread, whether the infection has spread deep down to the bone. Antibiotics, depending on what your doctor suggests, either intravenous or orals. You can locally debride the ulcer as well. Again, we definitely check how much blood supply you have. So that is when the vascular surgery comes in to evaluate if you have enough blood supply, because in order for the ulcer or a wound to heal, you do need enough blood supply in that area where the ulcer is. And again, keep your diabetes under control. That's definitely the big point that you can do to reduce the risk. Now, this is actually the next two slides, I think, are also going to be one of the important slides in the presentation: diabetes and foot care. And I actually have a picture version of this as well. But again, I would like to discuss this as well before. So again, wash your feet. Diabetes and foot care is very important. Wash your feet daily, moisturize. Now moisturize, but not in between your toes, because if you do that, then that can increase your risk of fungal infection. So you moisturize the top, you moisturize the bottom, but just not in between your toes. And again, you have to look for trouble, right? That's what I tell my patients. You have to look for trouble. So you look for redness, you look for infection, cuts, blisters. Again, look for trouble. You don't have, anything, you're good. Again, do not walk barefoot, because you can get hurt, especially if you have neuropathy where you don't have sensation in the bottom of your feet. You may not feel if you get hurt. So again, that's why do not walk barefoot if you have diabetes. Keep your toenails trimmed. Wear comfortable and well-fitted footwear. Smoking cessation is important, as we talked about. Seeing a podiatrist or a foot doctor is important. And as I said, diabetic shoes, diabetic shoes and inserts, again, they are definitely covered by some insurances. So please check with your insurance company and your doctor to see if you can get the diabetic shoes. And again, this is just a picture version of what I said. So again, the first one, I hope you can see my arrow, is, again, washing it. The second one is to dry it, especially again, make sure the area between the toes is dried well. You feel for bumps, you feel for, you're looking in between each toenail. You see this picture, the fourth picture, the right topmost picture. If you see, again, this person is actually opening in between and seeing in between the toes to check, if there is any problem, because sometimes, again, if you just check quickly, you may not see it. Again, as we talked about, keep your toenails, again, file them, don't let them grow too long. And again, check for dry, cracked skin. As we said, that we can have some skin changes in the present, skin changes in diabetes, and examine the bottom of your foot. So yeah, I wanted to actually see this. I hope you can see my arrow. I'm going to actually move my cursor. So you see how, this person is actually holding a mirror. Well, it's not easy for all of us to actually flip our feet and see the bottom of our feet. So again, if you can do that very well, go ahead. But if you can't, you may actually need to use a mirror to see the bottom of your foot, because seeing the bottom of your foot is equally important, because that's where most of the trouble actually with diabetes happens. And again, of course, look at what you find. And if you have any concerns, then definitely speak to your doctor about it. Now, this is what I actually like to tell my patients. Again, back to the ABCDE of diabetes, as I call it. A stands for A1c, and to remind those who probably may have entered the presentation a little later, A1c is the average blood sugar over the past 3 months. And the target in general is less than 7%. And when I say in general, the targets may be lower, the targets may be higher, depending on who you are, what you have, who you are, meaning what other medical conditions you have. And because again, the targets either may be stricter or maybe looser, depending on your own. It is very individualized, but in general, the target A1c is less than 7%. But again, depending on other medical conditions you have, this changes. B is for blood pressure, again, equally important. Again, keep your blood pressure under control. C is cholesterol, D is the diet, and E is the exercise. And we talked about, all of this briefly, but again, this is what I tell my patients. I want to make sure your A, B, C, D, E are covered, because it's not just about diabetes. It's not just about your blood sugars. It's basically getting all of these under control to get the maximum benefit, to get reduced risk of the complications for diabetes. Now, 2020 has been hard, and has introduced us to COVID-19. So I would like to spend a little time talking about COVID and diabetes. Now, we don't have enough data to prove that patients with diabetes are more likely to get COVID, but we do know that if you have diabetes and if you do get COVID, you are at a higher chance of getting complications of COVID, and you are at a higher risk of mortality, meaning you are at a higher risk of dying. Now, this risk increases if patients have uncontrolled diabetes, because, again, number one, your sugars are high. And number two, if you have uncontrolled diabetes, then you are also more likely to have complications from diabetes, for example, heart attack and stroke. And all of this together does put you, it compromises the body's ability to fight infections. So that's why if you have diabetes, you are more likely to get complications of COVID, as well as, again, the mortality rate, the mortality risk, I apologize, increases as well. Now, should you get the COVID vaccine if you have diabetes? Yes. Again, this was the first, one of the first criteria that they opened up, one of the those opened, again, those patients who had diabetes. Since we know they are at higher risk of getting complications from COVID, yes, you should get the COVID vaccine if you have diabetes. Now, in terms of, again, a lot of a lot of you may not be aware of this term, but there is something that is called as diabetic ketoacidosis. And this basically is a condition where there are very high blood sugars, and that leads to acid buildup in the body. And it causes a lot of electrolytes, sodium, potassium, everything, all the electrolytes. There is an imbalance of the electrolytes. Now, we know that when you have infection, any infection, not just COVID, but if you have infection, it causes high blood sugars, and that increases your risk of developing diabetic ketoacidosis. Now, the more commonly we see DKA in patients with type 1, but we can see it in type 2 diabetes. And since the treatment, so you have infection that raises the sugar. Steroids, again, steroids are given for treatment, again, for COVID, that can also raise your blood sugar. So again, those are some things that we saw a little more, again, more so if you have had uncontrolled diabetes to begin with. And again, as the last line of the slide says, higher your baseline A1c, higher will be your sugars during sickness. So again, just I told my patient last year, again, when I saw them, the one thing that you can do to reduce your risk is really please get your diabetes under control, because again, the higher you are, the more your risk is. So what can I do during this pandemic, which, again, if I have diabetes, right? Again, it's a question, one of the most frequently asked questions, again, that I had encountered from my patients. Take your medications, take your insulin, take your non-insulin injectables, whatever the treating physician or whoever is treating your diabetes has prescribed you, again, take it, again, make sure you take what you're supposed to take. Check your sugars. Unless you have data of what your sugars are running, you would not know how you're doing, right? So again, keep your follow-up visits with your doctors. Again, in 2020, and actually even now, we have done a lot of televisits. So again, televisits are where we do an audio and video, exactly like you are doing with me right now. So again, it's either a Zoom or any other software that your doctor may be using. Again, utilize that. Keep your follow-up visits. Again, it's important to keep up with your visits to make sure that you are safe. And again, we talked about the COVID vaccine. Again, social distancing, mask, hand hygiene, that goes without saying, definitely should be part of it. Get your sugars under control, right? Avoid smoking, avoid drinking, avoid drugs. And again, as I tell my patients, well, explore nature. Vitamin N is all yours, right? Vitamin N for vitamin nature, it is all yours. So again, explore nature, engage in some physical activity, whatever you can, to the best of your ability. That is definitely something that you can do. And again, have a balanced diet. Try to avoid processed food, try to avoid juice and soda, incorporate more fruits and vegetables in your diet. That's definitely things that you can do during this pandemic to reduce your risk. And again, staying healthy, again, go to the hospital if you need to, go to your physician's office. Please don't hesitate to ask, again, for in-person care. We are prepared, we follow safety guidelines, to protect our patients, and to protect our staff and to protect our own selves. And again, we all have, again, all offices have screening processes in place, temperature monitoring. And again, of course, the cleaning and sanitizing goes beyond saying. So again, you need to go to a physician's office, please go. You need to go to the hospital, please go. Do not delay your care, because we are prepared to take care of you. And again, these is the last slide of the presentation. Again, these are just resources for COVID-19 vaccine. Please get vaccinated. Again, there is information on this website. If you want to share this, please do in the chat box. And again, any questions, I will be happy to answer as well. I'm actually going to look at the chat box now. If anybody has any questions, I'll be happy to answer them at this point. If you have any comments, I'll be able to, I'll be happy to hear them as well.
Okay, so I'm just typing the links into the chat, but if you have any questions, just type them into the chat box.
Okay, so I have a question about what kind of skin changes besides dryness. I'm actually going to try to, bear with me just 1 second, because I think this may help you. Let me go back to the skin changes so I can present. So again, I'm not sure if you heard this, but let's see if I can. So again, as I mentioned, the skin changes, it can dry, it can peel, it can crack. Neuropathy, as I mentioned, that, you may either feel tingling or you may feel numbness. Calluses is another, again, skin changes that can happen. So again, calluses are important because you can actually, if the callus breaks, you can have an ulcer. So those are the skin changes that we see in patients with diabetes. The most important thing with diabetes is diabetes neuropathy and diabetes foot ulcer. And, again, those are things, again, that we are really worried about, besides, of course, everything else that we talked about. And the blood supply, as we talked about, if there is compromised blood supply, if there is a wound, even if sometimes it is a small wound, it can actually grow bigger because it may not heal. So again, so smoking cessation, blood pressure control, cholesterol control, diabetes control, again, those are all important, to help, with the blood supply, and checking for enough blood supply and taking action to fix it if we can, again, those are important things. For body, there is no specific, the question is actually, what are the skin changes in the body per se? Not really. Again, there is no skin changes. For diabetes, again, if you have a low blood sugar reaction, you may sweat a lot because that is one of the symptoms of low blood sugar. So again, that is in generalized, you may notice increased sweating, but it is not an all-time thing. It is only when your blood sugar is low. So I have a question. Again, I won't be able to answer specific questions related to your conditions, but I'm going to try to generalize it. There is a question about if you have high readings in the morning, again, and the A1c is around 7%. So usually there is an average, right? Again, A1c is an average blood sugar over the past 3 months. Now there is something that is called as dawn phenomenon, where, again, when the sugars are high in the morning, right? The question that I ask my patient is, what time is your dinner? Now, if, I usually recommend patients to, have their dinner earlier because you have time, and then be a little active after dinner so that you can metabolize what you have had. If you have a very late dinner and you are really just sitting on the couch and watching TV because you've had a long day and you're going to sleep, or if you have an early dinner and then get hungry and have cookies, say for example, for a dinner, for a nighttime snack, which you should not. But say for example, if you have a high carbohydrate containing snack at night, or if you have a late dinner, those are the two common reasons for having a high blood sugar in the morning. And again, there is also something that is called as dawn phenomenon, which is basically a mechanism where there are certain hormones that are secreted in the body around 3 o'clock, 4 o'clock in the morning that can make your blood sugars high. Again, I can't comment on a specific question of, what the A1c and what this is, but in general, again, if the high blood sugars are there, if you have a late dinner, if you can fix it, have an early dinner. And if you do end up having a snack at bedtime, then try to have a snack which is low in carbohydrates. Try to stick with your vegetables, have a little protein. If you're having a piece of fruit, have it with a little protein. You can add hummus, or you can have a little peanut butter, or you can add cottage cheese, some form of protein, right? Again, when we add protein to carbohydrates, the blood sugars doesn't rise as much. So again, the key part in, again, a lot of things, again, this is in general. If you have kidney disease, if you have this and that, then of course speak to your doctor. But again, in general, again, low carbohydrate, high protein, and mixing carbohydrate with the protein, not eating a plain carbohydrate snack is what is recommended. Reynolds disease is, again, a rheumatological specialty. There is no connection with that. There is a relationship between, again, actually I'm on the slide, as we call as intermittent claudication, which is basically due to compromised vascular supply. Reynolds disease is usually managed by a rheumatologist, so you should speak to your rheumatologist about that. The question actually was, is there a connection between diabetes and Reynolds disease? So I just gave an answer to that. Thank you, Ronnie, for your comment. Let me just make sure I'm not missing any questions. So skin, I actually missed one question. I apologize. So again, what about, the question is, what about skin tags of the neck? Is this a sign of diabetes? So skin tags can happen to people just because they, again, they are more prone to developing skin tags. But if you have a lot of skin tags, sometimes that can mean insulin resistance. So again, it is not a reason enough to get screened for diabetes. It is not one of the recommendations, but if you're having, again, if you fall into the criteria, let me actually see if I can, bear with me just 1 second. I'm going to actually go back to the screening slide. Okay, just so that we are all, again, seeing. So again, these are basically if you have, if you're obese, if you're overweight, if you have a family history of diabetes, if you have women who have PCOS, which is polycystic ovarian syndrome, if you have a history of delivering a baby more than 9 pounds, if you have high blood pressure, high cholesterol, the ethnic groups that I listed, and, again, these are, again, risk factors that you should get screened. Again, as I said, skin tags, having skin tags per se doesn't mean that you have diabetes, but again, if you have, again, sometimes this may represent, insulin resistance. So, you can speak to your doctor about if they think that you should be screened for diabetes. So the question is, what about diet drinks, not soda, but iced tea and other sweeteners? Again, limited, right? Again, it's all about, again, yes, short answer is, again, diet soda is better than regular soda because regular soda has so much sugar. We actually have displays on how much sugar. It's unbelievable when you actually visualize it, how much sugar a regular can of soda has. So yes, definitely it is better, but I always tell my patients to stick to water because that is the best hydration drink. In terms of sweeteners, again, I'm assuming, again, you're talking about the artificial sweeteners, again, you can either choose the artificial sweeteners, or there are people who I meet who say, I don't like the taste of artificial sweeteners. I know I shouldn't have too much sugar and I will have nothing. So I have both kinds of patients, again, who choose either nothing or who choose artificial sweeteners. Again, it really depends on the portion, right? Again, if somebody is drinking 5, 6, 8 cups of coffee, it adds up a lot, right? No matter what you are having, no matter whether sugar or, sweeteners, you're having, it will add up. So everything is all about portion control. You really don't have to give up anything, again, of course you cannot have cookies and ice creams all day, but it's not about giving up. It's about limiting the portion and increasing, again, reducing your carbs and increasing your, again, it's a balance that you have to make when you have diabetes. So portion control is really all about portion control. And we all are human beings. And, again, it's okay to cheat once in a while, but once in a while means once in a while.
Okay, so we could do, oh, there's a new question that just came in. So.
Okay, let me just read it. Hold on 1 second. So the question is, reduction of white rice, carbs, and cultural foods in Asian upbringing can be done, but when dining out in Asian gatherings, should I modify just with vegetarian meals, or as you said, just portion control? It's not about whether you are vegetarian, if you're eating vegetarian, plant-based, or, again, if you're eating meats, you can choose lean meats, right? Again, chicken and fish, and, again, you can turkey, you can choose that. But yes, again, it's hard. to control, especially when you are going out to eat yourself, and it is even harder when you are in a gathering where you actually have no control of the foods being offered. And as you actually rightfully said, yes, it is really just about portion control and having less carbs and more protein, choosing from whatever is out there when you're going out in a gathering. So the question is, the question that came up is, how often can I cheat with ice cream? It depends. I'm going to give you that answer. Again, it depends on, where your diabetes is, again, how strict you should be depends, of course, everybody should not be having high carb, high fat containing meals on a routine basis. But again, that answer, I really don't have an answer, a specific answer to your question, but it really depends on where your diabetes stands, right? Also, as to, again, if your blood sugars are running in the 300 or 200 range, then you have to be more strict with yourself. And if it is not, then maybe you can cheat a little bit more. But again, there is no number that I can specifically give you. I tell my patients, you are not robots. If you're going to follow, it's all about changing your lifestyle on a long-term basis. It is not about what I can do for my diabetes for the next 2 weeks or 3 weeks. Okay, I'm going to stick to this diet plan for 3 weeks. Well, then what? What's going to happen? So it's not about changing your diet completely for 3 weeks and then going back to where you were, or probably even worse, because then you will have a rebound, because now you would want to have something even more than what, right? When you follow a very restricted diet for 3 weeks, 4 weeks, 6 weeks, 8 weeks, right? Name it. But then what's going to happen after that? Again, this is something that we have to change over a period of time. So it's about learning how to change yourself over time, not about what I can do today or tomorrow. So it's a long answer to your short question. So, but there is no right answer for that. So do the best you can.
Okay, so just do last call for questions. Okay, so I think that's it for questions. Right, so thank you, Dr. Patel, for taking the time to present, and then also for answering all of our questions. And then for everyone who's joined us, thank you for joining us, and also please join us for our upcoming health programs. So on this Friday, May 7th at 12 p.m., there will be a talk about asthma. And then our next Lunch and Learn with Hackensack Meridian Health will be Stroke, What You Need to Know, on Wednesday, May 12th at 12 p.m. And for more information or to register, check the library's event page at ebpl.org/calendar. And thank you again, everyone, for joining us for today's talk. And take care and stay safe. Thank you.
Take care, everyone. Bye-bye.
Thank you.